Hi guys, let's study pectoral region. So today's topic is our pectoral region, and pectoral region consists of fascias and core muscles, which we will see. That is pectoralis major, pectoralis minor, subclavus, and serratus. Okay. Now let's see the deep fascia, which is also called pectoral fascia. So it is a thin membrane because it's a fascia that invests the pectoral major muscle. So why it is being called pectoral fascia? Because it actually invades the pectoral region. I mean the pectoral region also and the pectoral major muscle. Okay, so that's how it is. So as you can see, pectoral fascia covering the pectoralis major. This. Okay. Then we have the attachments. Superiorly, it is attached to the clavix. Inferiorly, it is attached to the rectus shelf. You can see here. Okay. And medially, it is attached to the sternum, in front of the sternum. Here we would have some sternum. You can't see here, but here we sternum. And then laterally, we see it continues with fascia that covers the deltoid muscles. So uh, lateral, you can say the fascia, the deltoid muscle, you can have it. Now let's move further. So let's see the muscles of pectoral region. Okay. So here we have pectoralis major, pectoralis minor, and subclavus. All right. So let's see the origin of pectoralis major. So this is the pectoralis major. You can see this is the muscle. Here we have the pectoralis major. So yeah, clavicular head. The origin of it is from clavicular head. This is our clavicular, and this is the head of the clavix. So the origin is from there, and to get more definite, uh, it is the anterior surface of medial one half of the clavix. So it's gonna be from here. Okay, one half of the clavix. Then we have another region that is sternocostal head, which you can see its head. Okay, it's again the anterior surface of the sternum. Second to the sixth cartilage, costal cartilage. Okay, then we have the pectoral minor. Pectoralis minor is from the third to pectoralis minor. You can see here actually pectoralis minor. It's the third, fourth, fifth grade. Lateral to the, it's coming from lateral, the lateral side to the costal cartilage. Okay. So here's the origin. You can see it's the origin. Then the insertion is here at the coracoid, which you will see. Then if you subclavus, the origin is junction of first rib. There is a subclavus. The origin of the first rib, just under the clavix. Okay. And to the first posterior cartilage, creating first costocondylar junction. That is the first corneal junction. So these are the origins so far. Now let's see the insertion of the muscles. Now let's see the pectoralis major. So pectoralis major insertion is pendant the lip of vesical groove at the humerus. Okay, so this is the humerus and this is the lateral lip of vesical groove. So here we have to a pendant. Here we have the insertion and the pectoralis major. Then for the pectoral minor, we have upper surface and medial border of the porifices. So and we see his insertion. The origin is here in his insertion and the porifices, upper surface of the medial border of porifices. See here. Now let's look at the subclavus. So the subclavus and the insertion is a group of subclavus of subclavus and then he is at base of the middle third of the head. So it's here in the middle third of the clavus. Then section here. So now it's called group of subclavus. Yeah, there it is. Then the nerve supplies, the pectoralis major nerve supplies, medial pectoral nerve, lateral pectoral nerve, all the pectoral nerve are going to supply to the pectoral region. Okay, look again the pectoralis muscles, like the pectoralis major, pectoralis minor are going to be supplied by medial pectoral nerve and lateral pectoral nerve. Then the subclavus is the upper subclavus, it's gonna be supplied by the same nerve. So it's quite easier to remember the nerve supply of these muscles because they have a similar name as their muscles. Now let's see the actions. So the pectoralis major, which is right here, it abducts and medially rotates. So you can see it's helping in abduction and it medially rotates also, helps in rotation also, rotation of shoulder joint. Here's a shoulder joint, helps medial rotation of the shoulder joint and it also abducts the bone muscle. Now, another, it flexes the head of the shoulder. So it also flexes the hand of the shoulder joint. Yes. And when insertion is fixed, muscle draws the trunk upwards towards upper limb as in climbing. So in the climbing, it also helps. Then let's see the pectoralis minor action. So it does protection, then depression of the scapula. So here's the scapula. It's helping in the protection of the scapula and depression of the scapula. So if you know from backside you can see the protection of the muscle. If you try to um, somehow wash your shoulders upwards, your scapula will also get upwards. Same as the depression on the scapula, you can feel it and feel it. So for all that, the pectoralis minor is helping it. Now, subclavus. Okay, so it helps in the movement of the shoulder girdle. Shoulder girdle, girdle is there. Okay, so it helps in the, yeah, helps in the shoulder girdle. Okay, that's what we saw. Now let's move to the other side. Okay, so let's see the clavifactorial fascia. Okay, so we can see here we have the clavifactorial fascia. This is the region of the clavifactorial fascia. Okay, so now let's see the definition. A strong shell sheet of fibrous tissue, okay, that lies deep to the clavicular head of pectoralis major. This is a pectoralis major muscle. And they are saying that it lies deep to the clavicular head of the pectoralis major. So here, muscle in the gap between the subclavus. Okay, subclavus is here, the gap of the subclavus and the pectoralis minor, and covering the axillary vessels and nerves. So covering the axillary vessels and the nerves. Okay, this is our clavicle, clavibacterial fascia. Okay. We saw the deep fascia, pectoral fascia, which has a pectoralis major. Now we are seeing the clavicopectoral fascia. Okay. Okay. So the attachments superiorly, inferiorly, medially, and laterally. So let's see the superior of each attachment. So it splits to enclose the subclavus and it attached to the subclavus fluid. So here we have the superior attachment. Then inferior attachment is pectoralis minor. Two layers fuse at the border, lower border of the pectoralis minor and continue at the suspensory ligament of axilla. Suspensory ligament of axilla here, which fuses with the axillary fascia. Okay, so that's fusing with the axillary fascia also. So that's how we have it clearly. Now, immediately, it blends with the fascia over the first two intercostal space. First two intercostal space is this. And now, and is attached to the first rib. Okay, and attached to the first rib, medially. Okay. Literally, it's attached to the coracoid. Literally to the coracoid. Okay, so we can see Pectoralis major and fascia here, that a deeper one is pectoral minor fascia, which we can see here. Then subclavus fascia here, all the fascias, and claviculobacterial fascia. Okay, so subclavus fascia, pectoral major fascia is all here in claviculated fascia. Now, the note is that between the first rib and the coracoid sign, the fascia often thickens to form band known as costocoracoid ligament or membrane. So the fascia here between the first rib and the coracoid process thickens just to form the band, which is often called costocoracoid ligament or the membrane. Costocoracoid ligament is nothing but a fascia, thickened fascia.